This Clinic on Wheels is a tech-enabled Clinic on Wheels initiative taken by the IMS Foundation. It's a CSR initiative. This Clinic on Wheels is a very different and one of its kinds in Pan-India. The reason behind that is this Clinic on Wheels is not only delivering the health services at the doorstep and also providing the skill centers and also helping the villagers to uplift their social economic growth. Villages suffering with the addictions problems. In this Clinic on Wheels, there will be a counseling center for that, and those people will be sent to the de-addiction center. So overall view, this is an entire glimpse which will be showing you in the presentation. The Clinic on Wheels, which will be working for healing rural India. This is a concept of Heal Rural India under CSR umbrella. As we see, Clinic on Wheels is our all aim and the mission is स्वस्थ भारत का निर्माण, आपका महत्वपूर्ण योगदान, बीमारी मुक्त भारत है हमारा ही अभियान. Without your support, without your guidance, dear doctors, it is not possible. Clinic on Wheels is a mission in India from today, which is being inaugurated today, to heal rural India and tribal India. We all are very much aware that country health system has a very important role in nation's peace, happiness, wealth, growth and success. The complete health system defines where diseases are given attention with best of the treatment plans available. At the same time, it becomes the responsibility of the health system that to spread the health awareness and the healthy lifestyle adaptation, then only we can erase the diseases from our nation. As I said, Heal Rural India is a mission of IMS Foundation. We are trying to bring a digital health screening revolution. The aim of our IMS Foundation is to make India as a disease-free nation. India can become disease-free not only by treating, but also by spreading the awareness equally among the country people. We believe a healthy person can develop a healthy society can develop a healthy state, and a healthy state can develop a healthy nation. There are some few facts which we want you to put attention here. In India, currently, total number of villages are existing is 6,60,000 approximately. We have currently 24,800 approximately PSCs. Urban PHCs are near about 5,100 approximately. Till date, doctor practicing in India is 10,41,000. Today in India, the count of medical colleges is increasing day by day, which has been reached in 2023 is 650 approximately. Now, we would like to put your attention in the disease called diabetes. If you see on this database, majorly the people suffering through disease diabetes is the people who doesn't have the awareness towards the diabetes. If you see the point which is highlighted, it's adult with a family income below the poverty line has the highest prevalence for both men is 13.7% and women 14.4%. People with less education, people with less awareness are prone to get diabetes and prone to end with diabetic problems. Same for the hypertension. Would like to bring your attention in the last line, which says only 12% people with hypertension in India have their blood pressure under control. Imagine India is such a vast country, only 12% people are having the blood pressure under control. What does it state? It is a hint to get our all attentions where uncontrolled blood pressure. Why the people go for uncontrolled blood pressure? Because they are not aware, they are not educated what could happen, what are the body is gonna face the scenario if the blood pressure in a body is uncontrolled. That's the main reason where the people end up in facing heart attacks, strokes, and are responsible one of the total death causes in India. Seeing the diseases in a way where treatment is important, but more than the treatment, awareness and education is also important to the disease. Our main project is focusing on the diabetes among the people, blindness, hypertension, anemia, especially in females and the children, pregnancy, malnutrition. These are the major focus where IMS Foundation will be working in the rural areas of India. Now, this is a quick workflow that you must get a confidence. How do we achieve this aim? How we are going to make this dream true? So IMS Foundation workflow will be, we have 3 parameters here. This is a tech-enabled clinic on wheels, control center unit, which will be placed in Bangalore. And the third unit is very important, attachment of medical colleges of India. The first role of tech-enabled clinic on wheels is to be associated with medical colleges, district and area-wise. Under that, skill training enrollment will be occurring. Drug addiction control unit will be run in this clinic on wheels. Control central unit is going to follow quality patient health screening. Real-time monitoring. Medical colleges cannot hide any data when it is visiting the camp. Continuous follow-up by IMS Foundation health workers will be done on the medical colleges ground and as well as the camp area. The community-wise, area-wise disease data collection. This is a very important point. IMS Foundation over the span of 5 years will be able to provide community-wise, area-wise disease data collections, which will help our research center to diagnose the predominance of epidemic diseases. Socio-economic upliftment planning, skill training and the placement. What are the responsibilities of medical colleges here is to provide doctors and the health workers. It's responsibility to provide treatment with required medicines at the camp completely free of cost. To provide admission in the medical colleges only if required and deliver the best treatment within the restricted period of time. At the last, they need to report the entire treatment progress to the IMS Foundation. We all know what is medical colleges in India. We name it as a Gurukul. Medical colleges are the important pillars of the nation, of the society, because medical colleges produce the best doctors in the country. They get education in the medical institutions. Already medical colleges are contributing a lot in building the nation's health. We cannot ignore this fact. This is a mission where medical college has to play a responsible role for running and maintaining the clinic on wheels. Over the period of time, each medical college has to get committed, should adopt a cluster of village. What is the global impact through this project? If you see, a country should have happiness, success, growth, wealth. But eventually, we cannot ignore the entire fact of company happiness, success, growth depends upon the country's health system also. So health system, where we are providing awareness and screening, we are providing the support and the treatment, which will eventually lead to the confidence, peace, success, growth, wealth and happiness. What is the main objectives of Heal Rural India is Shikshit Bharat, सशक्त भारत, स्वस्थ भारत, आत्मनिर्भर भारत, निर्भय भारत का निर्माण. How we are reaching all these aims is we are trying to educate on the health ground, that is Shikshit. We are doing the health screening on the doorstep. Sashakt Bharat, we are trying to build our country people day by day strong in their health system. Healthy lifestyle can only erase the disease is Swasth Bharat ka nirman. Skill training, Atmanirbhar Bharat. Until and unless we don't train our village people to become self-sustained business model or self-sustained farming model, we cannot make them Atmanirbhar. So we are catering that also. Say no to addiction, that is Nirbhay Bharat. Any people who are facing the addiction in the life has to strongly say where IMS will play a strong role in counseling and putting them to de-addiction center. This is our working module. Disease-free village. As you see here, the bus will be visiting the Gram Panchayat, contacting the Gram Panchayat people, and the clinic on wheel will be visiting the village where the patient will get enrolled and the Ayushman Bharat card has to be issued then and there. If the villages are having the Ayushman Bharat card, continued. If not, they have to issue the Ayushman Bharat card. Later on, there will be a person who will be collecting their family tree chart to help them in a socio-economic level. Going ahead, the nurse will take the vitals and refer the patient to the doctors. The doctors has to screen the health first and also send them for the blood test checkup and the urine checkup as a regular flow of the clinic on wheels. It's a responsibility of the medical colleges to do the test of blood checkup and the urine checkup in the medical institution itself and provide the proper report to the villagers. Along with that, if the villagers are not found to be diagnosed with any disease, doctors are forced to give the nutritious medicines and the proteinous medicines to the villagers. At the end, there is a counseling center which will treat them and educate them through the videos for healthy lifestyle. If the patients requires the admissions, the medical college has to bring the patients to the medical institutions, get admitted and provide the best of the treatment available through the hospital itself, completely free of cost. That's all about Clinic on Wheels. We would require your all support, guidance to make this project at pan-India level. Dhanyavad.